You exercise, you eat right, you do everything you can to look and feel your best. The sad truth is, sometimes that just isn't enough. Most of us form stubborn areas of excess fat. You know, that muffin top, or those love handles. Bulges that are immune to diet and exercise. So your jeans don't fit. Your little black dress is too little, and your mojo is MIA. But now there is something you can do to get rid of the bulges that are keeping you from feeling your best. Coolsculpting is a revolutionary new contouring treatment that uses the power of cooling to eliminate stubborn fat the safe, non-surgical way. Developed by Harvard scientists, this contouring treatment is FDA cleared for fat reduction, with proven results seen in clinical studies. So how does Coolsculpting work? It all begins with a consultation, where you and your doctor will assess your problem areas and create a treatment plan based on your goals and realistic expectations. Then you'll book an appointment to lose that stubborn fat. On your Coolsculpting treatment day, you should arrive wearing loose, comfortable clothing. The technician will apply a gel pad to protect your skin. Then the applicator delivers vacuum pressure and cooling to the targeted site. As the applicator pulls the bulge into the cooling panels, you will feel a firm tug and pinching and intense cold. There may initially be some tingling, but this typically subsides as the area gets numb. The fat cells are targeted and cooled, triggering their natural death. And because fat is more sensitive to cold, surrounding tissue and muscles are not affected. Over the course of the next few weeks, your body begins to naturally eliminate the dead fat cells. As the fat cells are eliminated, the remaining cells condense, resulting in an overall reduction of the fat layer. Depending on your personalized plan and goals, your treatment may last from 1 to 3 hours. When you're finished, you can return to your normal activities, including your workout routine. Some side effects may occur, including bruising and redness, numbness, soreness, or tingling, but they are only temporary. In the weeks and months that follow, you will see an undeniable reduction of fat, and as long as you maintain your healthy lifestyle, the treated fat cells won't come back. In your follow-up visit, your doctor will take after photos so you can really see how effective your Coolsculpting treatment was. You and your doctor will assess your results to determine if you would like to have another treatment on the same area or treat other problem areas. Best of all, your clothes and your confidence will be exactly where you want them. Your little black dress will fit just right. You'll make peace with your two-piece. Your physique in that t-shirt will turn heads again. And those jeans won't be topped off with unwanted bulges of fat. You have the power to get back your swagger. You deserve to look and feel your best without surgery or downtime. It only takes an hour to own your mojo once more. Reclaim the real you with Coolsculpting.
Introducing Sculpture, the world's first light-based, non-invasive lipolysis device to treat stubborn fat. This versatile system can target multiple anatomical areas during a single 25-minute procedure. 4 flat, non-suction applicators and contouring frames can be customized into a variety of configurations to meet patients' needs. The 1060 nanometer wavelength has a high affinity for adipose tissue. This energy is delivered through a proprietary modulation method and elevates subdermal temperature between 42 and 47 degrees Celsius within 4 minutes. Continuous contact cooling keeps the dermis and the patient comfortable throughout the treatment. The controlled energy delivery destroys up to 24% of subcutaneous fat in just 25 minutes. Over time, fat cells are eliminated by the body's lymphatic system. Results can be seen in as little as 6 weeks, with optimal outcomes in 12 weeks. Sculpture, innovative, light-based technology to destroy stubborn fat in just 25 minutes. To learn more, visit sculpture.com.
There are two types of fat that are located in the region of the abdomen. The subcutaneous fat, which is directly under the skin, and it is also the most apparent, but also the visceral fat, who, on the other hand, is around the muscles and vital organs of your body. The visceral fat is considered to be the most dangerous type of fat for health. Studies have shown that it increases the risk of developing certain diseases, such as cardiovascular diseases, type 2 diabetes, stroke, high blood pressure, and polycystic ovarian syndrome. Issued from scientific research, biostimology is using a biomagnetic field that is completely harmless for the skin and organism. The magnetic field is opening the calcium channels and stimulate the calcium release from the sarcoplasmic reticulum to induce muscle contraction in both smooth and striated muscle. This imperceptible muscle contraction induces energy consumption in the form of ATP. This calls for natural lipolysis, which is the breakdown of adipocytes and release ATP from visceral and subcutaneous fat. There is two medical indications for Reductim: the reduction of visceral fat and infertility treatment. The results on fat are 8% reduction in visceral fat, 4% in subcutaneous fat, and reduction of liver size. Clinical pregnancy rates after IVF are very satisfactory in a population with excess weight, obesity, renowned for poor prognosis.
Oftentimes, patients are looking for a more significant solution for their face without the need to undergo a full facelift. FaceTite opens the category of minimally invasive solution by offering a solution that provides a facelift result without the large scars or downtime. The FaceTite procedure uses radiofrequency energy for internal fat lipolysis and external collagen contraction for small body areas or the lower face, neck, and jowl. RF energy flows from the internal cannula toward the external electrode placed on the skin's surface. RF power is regulated based upon online measurements of skin temperature and tissue impedance. The heat generated around the cannula tip coagulates blood vessels and liquefies fat to reduce post-operative pain, bruising, and edema. Uniform RF thermal exposure aids, smooths, and evens contour results. Thermal contraction of fibrous septae and dermal collagen results in immediate contouring, which continues to improve over the next 6 months.